And speaking of our health, we have all had them, those horrible pounding headaches that seem to last forever. And those who suffer from chronic migraines will definitely want to keep watching.
Do you get frequent headaches? When do you know if it is more than a migraine? Well, in recognition of Migraine Awareness Month this June, we are joined this morning by headache specialist and neurologist Dr. Ira Turner and Good Housekeeping editor Laurie Jennings to encourage people living with chronic migraine to be proactive about their health. Thank you both so much for talking to me this morning.
Thanks for having us.
So, Doctor, I'd like to actually start with you. Can you kind of explain the difference between maybe a severe headache and chronic migraine, or even regular migraines and chronic migraines?
Sure, Heather. Chronic migraine is a disorder that evolves from episodic migraine. An episodic migraine, or what you call the regular migraine, is a headache that typically is characterized by a throbbing, pulsating pain that is worse with activity and associated with nausea, sometimes vomiting, and light or noise sensitivity. This can last a single attack for 4 to 72 hours, and we do have very effective acute migraine medications for this. But unfortunately, some patients gradually over time evolve or transform into a chronic migraine state where they wind up having more days with headache than without. And this is a far more disabling disorder that can really interfere with people's work, family lives, and social activities, and requires highly specific, specialized treatment for it.
And doctor, is it true that several people that actually do suffer from chronic migraine are not diagnosed properly?
In fact, the majority. Just looking at migraine in general, only about 50% of patients who clearly meet criteria for migraine have been diagnosed with migraine, whereas many of them have thought that they had sinus headaches or tension-type headaches. But most people who have disabling headaches really have migraine. And when it comes to chronic migraine, there are about 3 million or more patients in this country who fit criteria for chronic migraine based on questionnaire studies, but only about 20% of those have actually been diagnosed. And if they're not diagnosed, the other 80% are not going to be adequately treated.
Wow, these are some shocking numbers. Now, Laurie, Good Housekeeping is actually teaming up with another organization for a pretty great initiative that's actually going to help some people. Tell us about that initiative.
Well, we've teamed up with Dr. Turner and Allergan just to spread the word that you don't have to suffer in silence if you feel like you might be having symptoms of migraine or chronic migraine. So there are some great resources out there. One of them is BotoxChronicMigraine.com, which is a wonderful website that provides lots of information in terms of lifestyle modifications and even just help finding a doctor, help people find ways to deal with their chronic migraines. For us at Good Housekeeping, we have readers who are women across the country. Up to 40 million people are reading the magazine. And these women are probably many of the undiagnosed cases of chronic migraine. Women are 3 times, sometimes 4 times more likely to suffer from migraine and chronic migraine as opposed to men. So for us, it's really important to get the word out that you don't have to be embarrassed or ashamed or anything to talk about your symptoms. This is a real disorder with real possibilities for treatment. And we really want to just get people to understand that and feel educated in this area.
And I think that's great, and that's why this initiative is so important. So, doctor, while I do have you here, anybody who is suffering from these chronic migraines, do you have any advice for them this morning?
Absolutely. Start a diary, keep track of your headaches, speak to your physician or other healthcare provider about it. And if that is not working out, you should definitely see a neurologist or other headache specialist. And specifically, I would strongly recommend seeing somebody who has training in chronic migraine and particularly in injecting Botox properly, since this is the only specific FDA-approved medication for chronic migraine.
Well, some great tips this morning, really great information. Laurie, before I let you both go, can you tell us where we can go for more information?
Once again, that website is BotoxChronicMigraine.com.
Great. We will make sure to check that out. And I want to say thank you again to you both for joining us this morning.
Thank you, Heather.
Our pleasure. Thank you.
Now stay where you are. The Morning Blend will be right back.